Today we're talking about the two most common concerns I hear in my sex therapy room from women.
I think people have a lot of curiosity about what do people talk about with a therapist in general behind the closed door, and in particular with a sex therapist like you.
One of the things I love about being a sex therapist is that people come into my office expecting to speak about stuff that's difficult and that makes them feel uncomfortable. So we can just sort of like get right to the bottom of the problem, like we get right into it right away, which I really enjoy. And these are two problems I hear from women all the time.
Let's hear what they are.
So I would say the number one concern I hear from women in my office is they feel like they have a lack of interest in sex. Their libido's low.
Yeah, that doesn't surprise me as the most common.
Yeah, a low sex drive.
Yeah.
And it's a really big deal. They feel very overwhelmed by it. It affects their life. And even if their partner doesn't realize how challenging it can be, she's feeling it oftentimes day in and day out. It's overwhelming.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Welcome to the Sex Doctors, featuring Dr. Marianne Brandon, clinical psychologist and diplomate in sex therapy, and Dr. Abraham Morgentaler, renowned urologist and expert in sexual medicine and testosterone therapy. Together, they bring you expert insights into sex, intimacy, and relationships. Let's dive in.
Can you explain that? So if she's feeling it day in, day out, and it's the absence of something, absent desire, in what way is she feeling that?
Well, oftentimes at the beginning of a relationship, sexual interest just flows. It's just there. People just have it. And they often think that if they're like with the right partner, that's how it's going to be for the rest of the relationship. So what she's feeling is a lack of that kind of like innate interest, and she wants it back. And she's either feeling like she's done something wrong, like what is she doing wrong that has led to this lack of that drive? Or she's thinking her partner's doing something wrong. She's looking for an answer for missing something that was so exciting and vital for her.
Right. There's been a change for her.
A big change.
Yeah. So it's the change, and she's aware of it because sex or sexual imagery and stuff is everywhere, right?
Yeah.
On television and movies.
Yeah. And she had it oftentimes at one time.
Right.
And it was like an elixir of vitality and excitement that is really very difficult to replicate.
Yeah. So how do you handle it?
Well, I often start by talking about the fact that Mother Nature didn't really intend for people to be excited by the same partner decade after decade. It's just...
Mother Nature didn't determine that.
Mother Nature, if I may speak for Mother Nature.
Of course. Why not?
I feel that I've come to know Mother Nature very well as a sex therapist.
Yeah.
Like, because I hear the same things from everybody in my office. Like, it's not, it's weird. Like, when I first started being a sex therapist, I thought I was going to hear all this different stuff, whatever, and make a safe space. I would hear these very unique stories. They're not. They're the same story, actually.
Isn't that interesting?
Yeah.
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 You hear the same stuff.
Yeah.
Over and over.
Yeah, which is why I know that Mother Nature has such a powerful impact on people. People have their unique experiences for sure, and I don't want to minimize that, absolutely. But it always sort of like, it's like how many roads lead to Rome, right? They always lead to Rome.
Yeah.
And it always, whatever. So I understand that to mean that Mother Nature was really very motivated to get mammals procreating.
Right.
Like, that's what Mother Nature wanted.
Sex drive is powerful.
Right.
Until it's not.
Well, because Mother Nature didn't really care if a mammal procreated with the same person for decade and decade after decade. Mother Nature just wants the procreation happening.
Right.
And so there are natural, I wouldn't call them drives, but just like phenomenon that happen over time. Like, people get used to the same partner that's less exciting. People's bodies and hormones change, and then they have less of a drive. There's just these typical things that happen that can be really challenging for people in longer term relationships.
And going back to Mother Nature.
Yes.
So, there's data on how long people are married when they have kids. And I don't remember the exact numbers, but it all happens usually
Pretty fast.
in the first several years of relationships.
Right.
And then people are done with the baby making, and then they still have an ongoing relationship.
Mm-hmm.
And what I'm hearing you say is that the sexual piece of that relationship may suffer because the woman has decreased desire in a longer term relationship. Right?
That's right.
Making babies, that's the mother nature part. Sex is actually, I don't want to say invented, but sex is for reproduction.
That doesn't sound good.
Well, in terms of nature,
yeah,
that's how it generally happens. But humans are smart.
Right.
We've evolved. And us, like other apes,
yes,
also can have sex for other reasons other than procreation.
Absolutely.
The initial drive for every animal that's one of the basic drives, and it's for reproduction.
Right. And so I like what you're saying right now supports what I say to my clients, which is, so it's now time to sort of take matters into your own hands.
Yeah.
Your body isn't going to naturally just say, oh my God, like this is what needs to happen right now.
I hope you didn't think that I was saying you should only have sex in order to make babies.
No, well,
because that's no.
I know. I didn't think that, but it sounded like it. I was worried.
But from a biological point of view, the purpose of sex is so that babies can come from it.
Right. And then we as humans have developed other very appropriate reasons to be motivated for sex, like pleasure and connection.
We are,
and all this other stuff.
And that drive can persist even when baby making is impossible.
That's right.
Or not desired.
Right. So back to what I do with women in this circumstance is we talk about the fact that it's not unusual for things to shift in a long-term relationship and in terms of her own drive. So it's now time for her to become more active, to get her body kind of in the groove, because her body won't necessarily do that on its own.
So how do you do that?
So first of all, I ask her, what does it mean to her to be a sexual being? Like, get her to figure out what her goal is, because every woman's goal is going to be different. Is it an amount of sex that makes, is it the amount of pleasure she receives with sex? Is it what she's doing with her partner? Like, what is it that her goal is? And I ask her to sort of focus on a couple of things so it doesn't just become too broad and difficult to achieve, but rather she has a few focus points that we highlight. So she'll be able to she'll be able to focus at home on what to put her energy toward. And that's who she wants to be as a sexual woman.
Right.
So we do that, kind of figure that out.
I just had an image in my head, like as you were talking about what it means to her is important, right? Because people have expectations.
Yeah.
And those can vary from person to person.
Yeah.
And I just had this flashback to that classic Woody Allen movie. I think it was Annie Hall. It's got to be 30 plus years ago, where there's a relationship between the Woody Allen character and the Diane Keaton character, and they're both in therapist's office at the same time. Yeah. And you see a split screen. He's in one half and she's in the other. And the two therapists ask the same question: how often are you guys having sex? And he says, never. Yeah. And she says, we're constantly having sex.
I hear this.
He says, how often? And they both say the same answer, like whatever it was, 3 times a week or something like that. So for one experience, it says a lot. The other one is nothing.
I have to tell you, when I first became a sex therapist decades ago, I would hear this all the time and it would shock me. Like they would say, we just had sex on Sunday. The other one would say, we didn't have sex on Sunday. I'd be like, come on, people. Like, this isn't like complicated. Did you or did you not have sex? But I realize this happens all the time. So it's absolutely the case that the higher desire partner thinks it's never happening and the lower desire partner thinks it's always happening.
Right.
And I always suggest they keep it on a calendar because, just let's at least get the concrete facts.
Yeah.
But they have to agree on, just put an X on the calendar, whatever.
I've had patients who would see me in December. They say, I've had sex 52 times this year. They keep track of.
I have it too. People do that. But you know what they do is they keep track. The higher desire partner will keep track and not tell the lower desire partner.
Right.
Because it's like offensive in a certain way to be doing this. But it's actually, I think, healthy for them to both recognize, like, let's see what's happening and what's our goal.
Yeah. Engineer types also keep a lot of statistics.
A lot of people do this.
They keep them.
A lot of people do this.
They break it down into type of sex, where it was.
Yeah.
whatever,
Oh, they do that.
Oh, yeah.
Yeah. Yeah. So anyway, so I asked her to kind of figure out who she wants. What does this mean to her to be more sexual? Because of course, her initial reaction is, I just want to feel more desire. Great. But let's figure out, like, what exactly will this look like? How can we measure it? What are we going to focus on? So that's like the first thing. But then I talked to her about.
Can I ask you a question?
Yeah.
So I would imagine that a lot of the times that people go to the trouble of making an appointment with you and coming to see you as a therapist means that there's a certain urgency to it and a certain amount of pressure. It's built up maybe over time.
Yeah.
We need to go see somebody, or I need to go see somebody. And I would imagine that also means that there's a problem in the relationship that's prompting that.
I think that's right. I so often hear people say, this is our last stop. It's you or the divorce lawyer.
But here's my question for you. Do you ever see women by themselves who are bothered by a lack of desire because they feel like it says something that's wrong with them, rather than it being a problem? It doesn't, without it necessarily being a problem in a relationship.
Of course I do. I do see that, but much more frequently, I think the folks come to my office when it's really become a problem within the relationship.
Yeah. Desire discrepancy.
Mm-hmm. Yeah. Yeah. So I talk with women about what could excite them, like what could get them, what could remind their body that they're sexual and bring some pleasure. So that might mean playing with a sex toy a little bit every day, not to orgasm, but just to remind their body that they're sexual. It might mean reading erotica every day, like reading an erotic novel or just erotica on the web. You can find free erotica all over the place. So reading a little bit every day just to remind her body that she's sexual. So finding some things like that. Maybe it's watching porn or participating in a porn site for women. They have, porn for women that's created by women for women that is generally more palatable to many women than that porn that's more geared toward men. So maybe she can, join one of those sites, because oftentimes they're paid. There aren't many of them. Mm-hmm. But she can join one of those sites and just take a little a few minutes of viewing every day. So it's not to have an orgasm necessarily, but to keep reminding her body she's sexual. She's sexual. That helps her to kind of stay in the game, because you can imagine that if she's not feeling sexual and then all of a sudden it's time for sex, like how does she go from no sex, like not feeling sexual, to into it?
Right.
She's got to keep her body kind of dabbling in this, which is what happens naturally, like at the beginning of a relationship. So now she sort of has to do it more manually.
Right. What can the partner do to help?
That's a great question. And that's a question I would ask her and have the partner in to have a discussion about. Like, what can she think of that can be good for her that would be helpful?
Yeah. Are there incentives?
What do you mean? What?
Well, can a guy like trade doing the dishes?
Absolutely.
Taking out the garbage for him?
Absolutely. And you know what? And it's different for every woman, really, what works as incentives. It might be childcare. It might be, but I've gotten creative with people like, can your partner pay you for sex? Like, why don't you just fix him?
What?
Yeah.
An interesting idea.
Just like what's in it for you? And if she can't quite figure it out that day, maybe she can make $100 or something, like, I don't know, but it can be helpful.
Yeah. I could see some people having a strong negative reaction to that. Do you get that? Like,
most people laugh at it, like
right.
They just think it's funny.
Sex, but maybe that I could see that being pretty good. Listen, when my kids were small, there were certain things I would incentivize them to do this. And at the end of the day, I'm going to get you, like, whatever. If you're quiet on the plane, if we're going on a plane trip, we'll get you some ice cream or something like that.
Yeah.
Right?
Yeah.
Yeah. It's almost, yeah.
So, right.
So pay for sex. I bet that works.
Well, if people are open for it, it absolutely can work.
Yeah.
Yeah. So I think the point here is being creative.
It's a reward system.
That's right. Everybody wins. That's how you want it. You want this to be an everybody wins.
That win-win.
Yeah.
Yeah.
Yeah. So, yeah.
What's the second most common thing that you hear?
You know what I would say the second most common thing is women will say that their partner is like too careful, too passive in bed. Like she wants a little more action, and she's not getting it from her man. And this is, of course, from heterosexual people, but I hear that a lot, and I understand that. I hear that a lot.
So hold on. Too careful means what? That there's
Like touching too carefully, like asking too carefully if they want to have sex. Like everything is like a little too just.
Yeah.
There's nothing sexy about it.
Yeah.
I hear that a lot. Now, I understand that when I ask guys about that, they'll say, well, first of all, they'll say, well, like, I'm trying not to, you know what they'll say? It breaks my heart. I'm trying not to be my dad. Because they'll say they grew up watching their father sort of like bully their mom all the time.
Yeah.
And they made a commitment when they were young. They were never going to act like that. So these are really solid guys. They want to be good partners, and they're just trying to not replicate something awful. And then they hear about in our culture all the time how men could be abusive sexually, and they're just trying not to do that.
Right. Yeah, and then there's been this, I don't know what you want to call it, but this development where where not only do you need permission, but you need permission at every stage, right, in order to be respectful.
Yeah.
I think a lot of these guys are just trying to be respectful.
That's right.
They're trying to be what they think are good guys. There's so many cautions on it, right? There's so many red buttons associated with stuff that the primal energy is gone.
Primal energy is gone. That's exactly right.
Yeah. So if the women are looking for something that feels powerful, the guys are busy trying to be anything but powerful.
That's right. They feel like that's the thing that makes it worse.
Yeah.
And they will even say that. They'll say, well, look, if I try just to go for it, she doesn't like it. That shuts her down. It upsets her. So I hear that all the time from guys too. Like, she says she wants this, but when I give it to her, she's not happy.
So the guy's in even more of a pickle.
Right. And women will acknowledge that. They'll say, yes, that's really true. Like, on the one hand, I want to see his passion. I want to feel it. I want to feel his power, but it's not necessarily feeling good. So then I turn off.
Isn't that interesting? I wouldn't have known that was one of the most common things you see. So how do you handle that? How do you approach that?
Well, that's more of a session with the couple, not just one. Let me tell you, it's like often like ongoing dialogue about how to approach that. So he's got to agree to show up more sexually. He's got to agree to let his passion show in his face, which feels very vulnerable to him.
Say that again. Show his passion on his face.
Yeah.
Can you say something about that?
Well, that means like he can't just be careful and say, you up for sex tonight? Or is it, whatever. He's got to just like go for what he wants. He's got to show what he wants. Now that feels vulnerable to him because he's putting himself out there to be rejected.
Yeah.
So, it's a lot easier when you're in this careful place. Do you want sex? She says, no. Okay, fine. He didn't really put himself out. But if he's going to like really show up with his desire and she says no, that hurts that much more.
Yeah. And well, even more, I think for the guys is contrary to everything that they've been taught over the last decade or 15 years, right?
Absolutely.
Which is that the guys who are too overtly sexual are predators.
That's right.
They're trying hard to not give any inkling that they could be predatory,
right?
Even though they've got strong sexual desires, but they've got so many checks in place,
right,
so that they can feel like they're socially accepted.
Because it's a complicated message for guys. It's got to be a safe space for her.
Yeah.
But you also have to show up sexually. Like that's a difficult dynamic to negotiate. And the thing is, though, in a long-term relationship, he's got the safe space now. This isn't. We're talking in a short-term relationship. It's a different deal.
Yeah. I don't mean to make light of this for 1 second, but I had a golf lesson today.
You did?
Yeah. And what it reminds me of is that, the golf pro tells you do this, but you got to be totally relaxed while you're doing it.
Oh, yeah.
Right? So you're busy trying to recreate this motion,
right? But
your muscles have to be loose.
Right.
So that's hard to do.
Very.
And also takes practice, I think.
Uh-huh. Yeah, I think it is very similar, what you're saying. It's like,
golf and sex, they're almost the same.
Well, I haven't found that to be true, frankly, but maybe you do. I don't know.
Yeah. All right. We'll leave golf aside.
All right.
Yeah. But that's what it strikes me is the guys have a very fine line to walk. And it, on some level, I think it doesn't even compute with what their social training has been.
That's right. But, in short-term relationships, it's a different thing. This advice that we're talking about right now is for people that are in mutually respected, safe relationships. So he's got that basis, so he can step out. But if that's not been created in a relationship, then it's not going to work.
Yeah, I would imagine that part of your work is actually giving the guy permission to behave that way.
Right. And having her, helping her find the words to express what she needs, because she's confused too. Because on the one hand, she feels like she doesn't want to be touched in a way she doesn't like, but she wants his power and she doesn't know how to put that all together.
Yeah.
So everybody's confused. Frankly, it's very difficult. This isn't like simple.
Yeah.
But people struggling with it together and talking it through can be so helpful, because even if they don't come up with an exact way to handle it, they know the dynamic, and so they can kind of work their way through it together much better when they've had that opportunity to talk.
I'm going to borrow a line from an expert that I really appreciate and, in fact, love, and that's Dr. Brandon. And what she often says is that good sex is not politically correct.
It's not. It's also not for the lazy. Dr. Brandon also says that.
Dr. Brandon says
She does.
that. Dr. Brandon, I have so much respect for her.
Oh, well, she's been doing this for a while,
Yeah, good stuff. Well, what an interesting set of issues you have to deal with.
We should talk about these more, I think, because so many, I would bet that most people that are listening to our podcast can relate to one of those two, either in themselves or in their partner.
Yeah.
I mean, this is what it is. This is sex in a long-term relationship can be challenging. It's absolutely possible to work through this stuff, but if you don't really know the words for it, it can be very challenging.
Yeah, I appreciate that. Well, that's super. And this brings us to the close of another podcast of the Sex Doctors. And we hope that you like this content. If you do, please give us a thumbs up, subscribe, write a pleasant review. And we hope to see you again for another podcast of
The Sex Doctors.
Bye-bye now.
Thank you for listening to The Sex Doctors with Dr. Marianne Brandon and Dr. Abraham Morgentaler. Be sure to subscribe, leave a review, and tune in next time for more expert advice on sexual health and relationships.